Hello and welcome to Dublin Castle, where we're at the Clinical Academic Careers meeting. This is a meeting to help young doctors plan their careers and fund their careers. I spoke to Tom Fahey, who coordinated the conference.
This came about through two things really, Donal. I was funded as a visiting professor, a Flaherty visiting professor by the Ireland Canada University Foundation, and I travelled to Ottawa, Toronto and Vancouver in February and March of this year, and I met colleagues and we spoke about clinical academic careers in family medicine, and it became apparent there were very general opportunities but also challenges that we all faced.
I spoke to Professors Wendy Norman and Robin Tamplin to get the Canadian perspective.
I'm Wendy Norman. I'm the chair of the section of researchers at the College of Family Physicians of Canada, and we're here to tell you that every family physician can find inside themselves their inner researcher. Whether you are reviewing evidence or incorporating evidence into your practice, participating in a practice-based research network, or actually becoming a researcher, you will help advance the health of Canadians and improve the practice that you and your colleagues can do by channeling your inner researcher.
Canada is now making a huge investment in the strategy for patient-oriented research, much of which is going to be focused on primary care and improving chronic disease management in this area. I think today I'm going to focus on the actual essential necessity actually to build foundations in primary care, strong academic research foundations in primary care, mainly because it's the only way we're actually going to solve basically essential reforms for a health system.
Graham Love is the Chief Executive of the HRB in Ireland. He's a really key figure in the funding of research and general practice in Ireland. This is what he had to say.
At the Health Research Board, we're going to invest more and more in primary healthcare research. It's obviously a strategy of the government here in our healthcare service to increasingly invest in primary healthcare to make healthcare sustainable. But we have a number of challenges here at the moment, and we've just heard in some of the meetings earlier on. For example, how do we get central support to give doctors and GPs, for example, time out to run a research program in parallel with their clinical service is one of the greatest challenges we have and one of the ones we want to target.
I spoke to Professor Dee Mangan from New Zealand but currently at McMaster. I asked her for her thoughts.
There are systems and frameworks that need to be put in place, and money is obviously key. And a sense of collegiality and a sense of the importance of what researchers in primary care are doing. But the most important thing is to maintain the sense of fun and wonder that really underpins really excellent research. And I also think we should be proud of what we've done rather than forelock tugging, because more than secondary care, primary care has proved over and over again that what it does changes health outcomes for people. And the countries with the strongest primary care systems and the strongest primary care research are those with the best health outcomes for the population.
This was a great initiative that I hope will lead to future developments in primary care research both in Canada and Ireland.